What are the most common types of medical malpractice that happen in the Commonwealth of Pennsylvania? At Lupton and Uniton, we have had an opportunity to review hundreds and hundreds of potential medical malpractice cases over the years. As a result, we have seen a variety of different ways in which medical malpractice has injured or killed people in Western Pennsylvania. While every case is different, there are several basic categories that we find are the most frequent types of medical malpractice cases that we're asked to investigate. Number one is missed or delayed diagnosis cases. And this can happen in just about any area of medical practice. It oftentimes happens in the primary care setting when a primary care doctor fails to recognize the symptoms or the signs that a patient's presenting with that could indicate a more serious condition. But you see delayed diagnosis situations in emergency medicine, in surgical settings, in birth settings. You see it in pathology when doctors are looking at slides and they fail to properly interpret what they're looking at, which leads to a delay in the patient getting diagnosed. You see it in radiology when radiologists fail to properly interpret or determine what they're seeing on a radiology study, which again leads to a delay in meaningful and timely treatment that the patient otherwise needs. So delay in diagnosis or misdiagnosis is one big topic. Another significant area of medical malpractice that we're often investigating are surgical errors. And surgical errors, again, can happen in any type of surgical setting. It could be an oral surgery, it could be general surgery inside of the body, whether it's up in the chest area or the abdominal area, whether it's an orthopedic surgery, a neurosurgery. Any type of surgery carries with it a risk of injury, because the surgeon is doing something to your body. They are operating on your body, and sometimes if they don't follow the proper safety steps, they can inadvertently injure another part of your body. And if they don't recognize it or they don't fix it, or sometimes the negligent act of what they did to injure that part of your body is so severe it can't be repaired, that is another fertile ground of medical malpractice that we're often asked to investigate. Another significant area that can have devastating consequences for families that we're often asked to look into are birth injuries. And the birthing process, the laboring process, is fraught with risk. And so hospitals and the healthcare practitioners that care for pregnant mothers and their unborn children, or children that have just been born, have a very high responsibility to provide the best care possible to ensure that this risky situation does not become worse because of medical negligence. In a birth injury context, the injury to the child can happen both before birth if the mother is not monitored properly. Sometimes gestational diabetes is not monitored properly. Sometimes the mother has a condition called preeclampsia. In other situations, the doctors learn that the mother has a condition called placenta previa, or other issues with the placenta that can lead to a host of problems for mom and child. Another area is ketoacidosis. If the mother's diabetes is not maintained properly, that can lead to problems for both mom and baby. Then you get into the immediate delivery period. So that time just before the baby is born, which again is a very high-risk situation, because that process of contractions and the baby moving from inside the womb to out of the womb can have a host of stressors and potential injurious situations for the baby and the mother. In those situations, the babies have to be put on monitors and watched very closely, and the healthcare providers have to pay close attention to make sure that no injuries are happening to the baby, that the baby is not under distress that could cause a lack of oxygen, so that they can make a decision to get the baby out in a much quicker fashion via C-section if necessary. And then after the baby is born, in that what's called a neonatal period, oftentimes the baby comes out and has a difficult time transitioning to life, and so the healthcare providers have to do a good job and be very mindful of helping that baby through specific steps of acclimating, being able to breathe on their own outside of the womb. So birth injuries is another significant area of medical malpractice that we look at. Medication errors. In a hospital setting, in a pharmacy setting, There are a variety of ways in which patients can get the wrong medication. They cannot get a medication that they need. They can get the wrong amount of a medication. They can be told to take a medication for longer than they otherwise should have, all of which, in the right or wrong situation, depending on how you want to look at it, can lead to serious injuries for the family. There are a number of steps that can be taken to ensure that patients are not injured by medication errors, but because of the frequency with which people are being prescribed various medications and how those medications can interact with other medications, medication errors are another common form of medical malpractice that we encounter in the Commonwealth of Pennsylvania. Another big picture area in which patients are injured by medical malpractice happens with communication issues. And these are more systems failure type situations. And these are situations in the medical field where proper care is rendered, but information, maybe it has to do with the certain type of medication the patient should get. Maybe it has to do with additional care the patient should receive. Maybe the patient needs to be notified to follow up about an abnormal test result, is either not communicated to the patient or is not communicated properly between healthcare providers, which leads to the patient getting either inappropriate care or no care that they need under the circumstances. You'll see this a lot of times within large hospital settings, or you'll see it when there are differing healthcare providers that are not within the same facility. So example would be a primary care doctor obtains a certain test, radiology, pathology for the patient, and the test result shows something abnormal. And something happens where either the primary care doctor is not notified or the patient is not notified, but ultimately it leads to the patient not getting the proper care in a timely fashion. We see those types of cases very frequently as a form of medical malpractice at Louboutin and Uniton.